Hello, everyone. My name is Martin from Finance Oracle. Today I'm going to be discussing about healthcare job in GCC, healthcare job in Middle East. And when I'm talking about healthcare job, I mean doctor, being a nurse, being a doctor, being a lab scientist, being a pharmacist, you can name them in the Middle East. Yeah, today I'm not going to break it down to each of these professions. I'll be talking about how it works in general, and in future I'll be breaking them down to each of these professions. Now the first question is, why would you want to work in the Middle East as a doctor, as a nurse? Why work in the Middle East? Well, number one is that you will receive free flight tickets to and fro the Middle East at the beginning and at the end of your contract. This also usually includes a mid-year round-trip flight ticket, back home. So you may decide not to go back home, mid-year, and you may choose any of your holiday location. It could be the US, it could be Europe, it could be Asia, it could be somewhere in Africa. You will decide where to go to, and your flight ticket can be converted only if you've got a visa for this. And again, the annual leave also could be very generous. With some hospital offering up to 7 calendar weeks. Plus, you are going to receive bonus at the end of your contract. That means at the end of your contract, you stand a chance to get bonus. What it means is certain amount of money, bulk amount of money that will be gifted to you at the end of each contract. Mostly the contract are 2 years contract, which are renewable. So at the end of this contract, you stand a chance to get a bonus. Again, many holiday destinations, in Africa, in India, in Asia, in Australia, and Southeast Asia are easier to access from the Middle East, because the Middle East is like at the middle, of the world map. So if you want to go to Asia, if you want to go to America, if you want to go to Africa, East Asia, it is easily accessible from the Middle East. So it makes it a great place to live in. Now, for doctors and senior managers, they are usually offered family status in their contract and can benefit from an education allowance for the dependent children. This is not applicable in other places, but mostly the ministries. If you work as a doctor or as a senior manager, you are offered a family status. That means you are able to bring your family with you, and you are going to have a family accommodation, to accommodate your children, your wife and children. But for nurses and allied healthcare professionals like med lab, medical scientists and all that, mostly they are being offered a single status contract, which means they are not able to come with dependents or family members. They can only come alone. There are different healthcare boards across the Middle East and across the GCC countries, and they are all different in each of the countries. For example, in Saudi Arabia, we have the Saudi Commission of Health. In Oman, we have the Oman Specialty Board. In Kuwait, we have Ministry of Health Kuwait, and in Bahrain, we have National Health Regulatory Authority, and in Qatar, we have Department of Healthcare Professionals, and in UAE, we have Ministry of Health and Prevention. We have like Dubai Health Authority, we have in Abu Dhabi, we have other health authorities in Dubai, which also regulates practices in their own region, because they have a level of they have a level of autonomy. So now I want to look at, again, before you are able to register, you have to write an exam. And this exam, for example, is like, in Oman, for example, you have the piercing which is written by general physicians, GPs. I have the Prometrics, which is written by specialists, maybe O&G, pediatrics, and others. So it all depends on which exam you want to write. But let's take, for example, the Pearson for which the GP writes. It can be written in 6 countries in the world for Oman Specialty Board. For Saudi, Dubai, UAE, and others, they also have their own centers. But in general, if you write any of this, if you write this Oman Specialty Board exam, for example, you can practice in UAE, you can practice in any of the Middle East. You only need to complete the process there. So, for example, the OMSB can be written from Afghanistan. There is a center in Bangladesh. There is a center in Lebanon. There is a center in Nigeria. There is a center in Pakistan. And there is a center in Tanzania. So, if you are from any of this region, you can easily get access to write this exam. If you are from Ghana, you can easily go to Nigeria without a visa. You just need to board a bus or board a flight, go to Nigeria and write your exams. You can prepare online and write the exams, then you're good to go. There are a number of processes for you to do this. If you are still listening to me, please do not forget to subscribe and do not forget to share this, especially if it's making sense to you. Coming back to it, there are a number of processes. Number one is you need to write the Prometrics or the Pearson rule, depending on which of the registration you want to do. If you want to register as a GP or as a specialist. As a GP, you have to write the Pearson rule, and as a specialist, you have to write the Prometrics. Then, before the exam or after the exam, you can do your data flow. Your data flow is simply your verification to verify your results. I can also take the data flow as a separate discussion subsequently, because it's a bit of a long process. You have to, they have to write your school, and your school have to confirm, yes, this person has graduated from our school, and they have to verify your certificates and all that. So that is the process of the data flow. So it can come before the Prometrics or after the Prometrics, before the Pearson vote or after the Pearson vote. So after the Prometrics or Pearson vote, then you can go for a data flow. Then some persons, when they've gotten these two, if they've passed the exam and they've gotten their data flow, some persons apply for a job and they get a job, and their company arrange for Viva for them. Viva is like personal interview with the examiners. Pass mark for the Pearson vote is 70%. So depending, some other programs have lesser pass mark. For doctors, 70%. So if you pass that and do your data flow, then you can easily get a job. Then your company, your hospital can arrange your Viva for you. But in some other case, maybe you're not in some other case anyway, you have to finish your data flow, then you do your Viva. Then after your Viva, you start your job search. When you get a job, then you will, the company will, or the hospital will apply for a visa, and once your visa has been approved, then you can relocate. If you have gotten a job, sometimes visa can just take 2 days, sometimes it can take a week, sometimes it can take more. What I do not advise, like I've said in most of my videos, is do not rush to Middle East without getting a job, because if you do, it may not be easy for you to cope. Accommodation is expensive. You're gonna feed yourself, and you may not get a good job once you've come here with some kind of freelance visa. Someone accused me and said, do not listen to this guy. I am not an agent. Like I said, I'm looking for my pocket. I'm not an agent. I don't take money from people for immigration. I will only guide you in the process. And I keep warning people, do not rush to Middle East without getting a job. If you do, you may suffer. A lot of people have come and they struggle. They get some kind of jobs that cannot pay their bills, or that can manage to pay their bills, and they just wonder why they've spent so much amount of money to migrate. I do not ask for money to help you migrate. When I have opportunity, a lot of people whom I've helped to migrate, I help them free of cost. Most of them don't even call me to say thank you. after maybe 1 week or 2, okay? So all I wanted to do was to help people, and that I've done. But for now, this video is the help I'm granting you. You have to do it yourself, and you can do it. It all depends on you if you really want to do it. Some person will be like, come on, what is this? Is this gonna work? And some other people knew if they put in their time and effort, it's gonna work. So if you do this, it is as simple as that. This is what I've done time and again. I mean, if I want to go to Middle East, I know how to go to Middle East. I do this and I get my I find my way to the Middle East. So search for a job, get a job, and you can move. But for doctors, this is the process. Of course, if you move as a healthcare professional, you have money or you have someone to stay with, you can comfortably stay here and also do the process. But I mean, it's better you start it from your own country, where you're not going to become a liability to someone, either someone at home or where you stay, okay? So by the time you do all this process, I can guarantee you that you're going to get a job. If you come here as a health professional to the Middle East and you've done your exam and passed, you have your daughter full, you have a visa, you must get a job, because there are a lot of jobs for health professionals. I wish you the best of luck. I hope you take this advantage. Cheers.